Welcome back to another episode of the MedEd Well podcast, helping those in medicine take the next step in their wellness by using education around wellness to advance things in medicine for all of us. So, whether you're a physician, a medical student, a nurse practitioner, a PA, or someone else, I hope this really encourages you today. And I'm so thankful to all of you who have been listening, for giving input, for subscribing and sharing these episodes. And I can't wait to dive in to help you take that next step in your wellness journey today. So, today we're going to be talking about how you and your unique experiences really matter for how you show up in caring for patients. Your unique gifts, your talents, the things that you've experienced, the things that you're interested in, these all matter. You are a unique individual, a product of all that you've learned, experienced, and been through, and that uniquely enables you to connect with others as you care for them. I heard a quote recently. Someone said that it's not what you do, it's who you are. And that really resonated with me as I thought about it. It wasn't in a medical context, but I just wanted to bring that to you today because if you are maybe dealing with some imposter syndrome, like I can't do this because of whatever story that you may be telling yourself, that I tell myself, that you are uniquely suited and right where you're supposed to be able to care for your patients and your community. Maybe you're not dealing with the imposter syndrome so much, but maybe you've gotten to the point where going through the motions of showing up, doing your thing, and going home, it's become more of a job. And just rekindling that passion, that desire to help others, to care for them, maybe that's missing. And so I just want you to remember that there is no one else like you out there who is able to do what you do in the way that you do it. So today we're going to cover 4 different ways that you are uniquely prepared to be able to care for your patients as only you can. The first is your educational background. So for me, I was a physics major and pre-med. People have asked me about that. They're like, you did physics and then went to medical school? Yeah, I really enjoyed physics in high school. I enjoyed math and science, and it was just fun to see how the world worked and how using math and the equations could really understand more of how that was going on. And I went to a small college and really had the opportunity to interact with my professors, to get the mentoring and the feedback. This really uniquely prepared me to be a doctor. I was able to apply what I had learned as a physics major to really engage with, especially respiratory and cardiovascular physiology and pathophysiology. It's just been really fun to see how the different things that I learned as a physics major, not only the science, but also the how to think about problems, how to think outside the box. Even after my junior year in undergrad, I had the opportunity to do a summer research internship. And I went to this lab. It was at a larger university, and my supervisor, he said, did you use this one program with a little bit of coding? And I said, yeah, I had used it in lab before, but I didn't have the level of skill that he thought I did. And so when he provided me some code, I took a look at it as I was supposed to be processing these MRI data files so that I could characterize the composition of the coronary artery um, cadaver segments that we were evaluating. So I had these data files and I didn't really know how to get an image out of it, much less to be able to characterize what was going on in there. And yet, when he got some code from his colleague and gave it to me, I had to figure it out. And I did. It took many, many searches on the internet and much trial and error, but eventually I was able to get something out of it. And this was really instrumental in helping me see that even if I don't know, I can ask for help, I can look things up, and I can figure out how to move forward, which has really served me in medicine when sometimes there's just not clear cut answers. And pushing and asking for help, asking questions, researching, it can really help move things forward. And that's what I and my patients uniquely need in that situation. So, first, there's my educational background, and this may be similar for you, where your major or something else really prepared you for what you're doing now. It may be that you've had some struggles, that you've learned to overcome them. You didn't have the support or the schools that maybe looking back you thought you needed or that they held you back, but you have made it to where you are today because of what you've been through. And rather than seeing some of those things as just a hindrance or the challenge, they can be opportunities for you to say, this is what I learned from that. Or this is how, even in the midst of that, how I've been able to move forward and to get to where I am today. Not all on my own, because we can't do things all on our own. Ultimately, somebody or something helped us out. And so that can be an example to the patients. When I have patients in clinic that have struggled with their grades or they have these interests and they don't know if they could go on and do something in medicine, whatever they want to do. It's an opportunity to say, you are learning skills now that can really help you. So, in looking at how you are uniquely prepared to show up for your patients, first, we looked at educational background. Secondly, it's your unique personality that you bring to being a physician or someone who cares for them. So, I am a little bit quirky. If you haven't noticed that yet, go back and listen to a few of the other episodes. And I enjoy connecting with my patients. I enjoy using humor, especially meeting young children at various levels of their development, different ages, and caring for them and for their parents. Sometimes they come in to the clinic and they are really nervous. Sometimes they're just looking at me, looking back at their parent, and wondering, am I going to get shots today? Now, it's unfortunate and difficult when families will promise them that they're not getting shots. It's like, well, like actually, I would really recommend them, and you're going to need them for school. So sometimes then using some humor and some jokes to help distract them, or saying, did you have any jokes that you brought with you? Oh, Sorry, you didn't bring any. Sorry, you're stuck with mine. And it might be that I will compliment them on their shirt or whatever superhero they have on their shirt. And then I go look for the superhero, the dinosaurs, the princess, and I check their ears or something like that. And you may have your own ways of connecting with patients, whether that's asking them about a particular sports team or a particular hobby or just getting to know them. You bring your own unique, um, your own unique personality to this uh, opportunity to meet people where they are, being your unique personality. There's only one you, and this is a great opportunity to say medicine is so much more than just checking the boxes. It's so much more than just getting people in and out so that we can say we've cared for this many patients and met the expectations and done this for our schedule. It's an opportunity to say, how can I help this person, their own unique person, and me being my own unique person? How can we connect and help advance their health? I'm also an introvert. I've certainly grown through doing this podcast and doing videos as well. You can watch this on YouTube if you're interested in seeing me and my smiling face, but I've definitely grown in that confidence, and yet I'm still an introvert. I still enjoy a quiet evening, reading a book, planning things, but not necessarily all the noise and other things that go along with natural part of life. It's just part of what I need of having some downtime. And so knowing that is really helpful when I think about my day in clinical medicine. I'm around people, I enjoy connecting with them, but it may be that I really need to take 10 minutes, hopefully more at lunch to just have some time alone. I still connect with colleagues at lunch from time to time, but sometimes having a few minutes to just listen to some music, to read a book, to just sit there with my thoughts, it's great. And it helps me recharge. So, as we think about how you are uniquely suited to care for your patients because of how you're wired, first we looked at educational background, your unique personality, and then thirdly, the skills and passions and hobbies that you have can really shape how you show up for your practice of medicine. So, for me, a few of the things that I am passionate about are some of the tech and informatics things, being able to help my colleagues and myself, but being able to share different things about how the medical records work and how they can best implement them to help take great care of patients and to finish charting faster so that they can go home for what matters most to them. This is a passion of mine, not only in my coaching, but also in my clinical practice, being able to help my colleagues do this. And so, not everyone has this passion, but by latching on to what matters to me, I'm able to help others further their goals. Maybe you are really engaged with creating community partnerships to help patients with diabetes find um, whatever they're looking for, the supplies, the rides to appointments, getting their care coordinated. It could be any number of things. Some of the social drivers of health and food insecurity, of connecting families with parenting classes. The list goes on, but it's only limited by how we show up and do our unique part to say, this is what I'm passionate about. This is what my patients are going through and how I want to show up and make a difference. So one of the ways that is important for me to show up in that space is I'm really passionate about global health and caring for patients from all sorts of diverse backgrounds from all over the world, and something that I love to do. I enjoy speaking Spanish almost every day in the clinic, and I have an opportunity to do that through being a U.S. Citizenship and Immigration Services civil surgeon, where I'm able to complete their patients' immigration physicals for those who are my patients as either children or young adults up to 21. Unfortunately, the website will include just my name and my clinic address, and so it means that I get some requests from adults that I have to politely decline being out of my scope of practice. But it's a great opportunity for me to be able to engage with patients to help them in a way that is uniquely suited to me. I'm the only one in my clinic system that currently has that active designation, but it's been cool to just share about what my passion is and to hear that others have either done that before and need to get that reactivated. And it's just a means of encouraging my colleagues and providing that service to my patients. So it's not just those skills and passions about work things, but it's also some of the hobbies. And this kind of goes back to that unique personality, but just the different things that I'm excited about, engaged with, those just provide other connection points. For me, I enjoy playing music. I played soccer in high school, talking about sports. So with the World Cup recently, I was able to ask patients, who's your favorite soccer player? Or which team do you think is going to win? Or a couple of questions like that that just really made it fun, made it a point of connection and an opportunity to take my unique personality and to connect with their unique personality and just be to build that human connection. What is that for you? Is it that you enjoy a particular hobby or activity? You say, I enjoy going for bike rides or ways to be active as you brainstorm with your patients of how they can be more active or what they're already doing that you can encourage them in. It'll look different for all of us, but I just want you to take a moment and realize that it's not just the medicine. It's these other things that allow patients to feel like you are taking care of them, that you know them, and that they can connect with you. Even if it's something different or they know that you are willing to share a little bit about you and what matters to you. And it can be sharing whatever you want. It doesn't have to be something so personal, but just having those connection points can really go a long ways to increasing their engagement with their own healthcare. So, as we think about how you are uniquely wired, we had the educational background, your unique personality, and your skills, passions, and hobbies. But fourth, and I think probably most importantly, is looking at your life experience, the things that you've been through beyond just your educational background that uniquely enable you to connect with and to be an example for, and to just say, I understand a little bit of what maybe you've been going through. Now, this is not saying that empathy is about saying, I understand exactly what you're going through when I haven't walked that journey. But it's saying that there are things about what you've been through that can help encourage others as they see that, yeah, you've experienced some hard things too, or different challenges, whether that's, yeah, any number of things. For me, I've faced different challenges from my patients, for my colleagues. I've moved one state over in my life, and many of my patients have moved continents. I have just not lived the same experience. But for me, I've been through some really hard things personally. And as you've heard on the podcast before, my wife and I lost twins, miscarriage at 19 weeks, and um, it was really hard. And grief is hard. It's still hard, um, even 4 years on. And yet, that experience and seeing the value of community coming around me and encouraging me and just walking with me and saying, grief is hard. I now have new sensitivity and empathy for patients, not only seeing newborns whose mom's charts indicate that, yeah, maybe they have had a prior loss. Uh, but it's also saying, when I hear patients say, oh, it's the stress and this anxiety is related to, yeah, the anniversary of losing a loved one, and say, I'm so sorry for your loss. Grief is really hard. Or there are no words. I'm so sorry. So for me, my experience with grief has shaped how I show up for my patients, of how I slow down and really listen in a different way, especially when they start sharing some of these hard, traumatic things. And to say that I don't have any words or I'm so sorry, like those actually express a certain amount of I'm here with you kind of sentiment, rather than just saying, oh yeah, I understand because I went through something that, like, I don't understand what it's like to move continents in the middle of middle school. Yeah, that would be really challenging in a way that I personally haven't lived that experience. So, another way for me that my experience um, has prepared me for how I show up, both with my patients and with my colleagues, is that 8 months out of residency, I went through burnout. I was so exhausted, bringing notes home, staying late, coming in early. It was just, it was a lot. And I know that there are many in medicine who have walked a similar journey. Yours may be different than mine, if that's something you've been through. And it's hard. And I just want you to know that even if I haven't walked your journey, that I care about my colleagues. I care about you. And I'm so thankful that you are here listening and engaging with these topics because, yeah, like this whole episode is about being a whole unique individual, and we need you. We need you to be you in caring for patients and for your community, your family, your friends, and for yourself. And so, regardless of how this this hits you now, I want you to know that you're not alone. And so my experience with burnout has really shaped how I check in on colleagues, of how I am passionate about doing this podcast about coaching, about helping others in medicine. So, as we look back on today's episode, I want you to consider and to think about a few things. I want you to consider how how are you today? How are you right where you're supposed to be? And how could that be even more true? How could you connect with your purpose and caring for others if you really leaned into that a little bit more? If you took a moment to engage with these different points to say, how has my educational background uniquely prepared me for what I'm doing right now? How does my personality affect that? How do my skills, passions, and hobbies, and how does my life experience affect how I show up as a physician, as a medical professional, as a human being who is caring for others? And then I want you to think about, how does this make a difference for your patient care right now? And who might you be able to encourage, either a colleague or a trainee, a student, a resident, or fellow that comes and works with you in the next week or two? I want you to take a moment to write something down. You can hit pause, but write something down of how you are going to implement this, of how this really is able to help you connect to your why, your big priorities, why you went into medicine, why you stayed in medicine, why you are still doing what you're doing. Because ultimately, that's what's going to be able to fuel you in your work. Just showing up and working harder and doing all the things, it gets exhausting. And having that deep motivation is able to help me move forward, to me to keep doing what I'm doing as I look at, why am I really here? Why am I doing this? And what has uniquely prepared me to get to this point? So I'd encourage you to do that today. And I just wanted to say that I'm so thankful that you are here with me for this episode. I think it's a really special episode to be able to say, you matter. Your patients matter, and how you are able to uniquely show up for them, that matters. So, as we wrap up, I wanted to thank you for listening, for subscribing, and for sharing these episodes. If you haven't done that yet, I'd encourage you to think of one colleague, one trainee that you might be able to share this episode with. And then if you like the podcast and you haven't left a review yet, I'd encourage you to go on your podcast player and leave a review. It really helps get the word out as people are able to hear about it and to find out how this can really make a difference for them. And I also want to encourage you, if you haven't already, to get your free guide on how to help you finish charting faster, which you can find at mededwell.com/efficiency guide. I'm really excited to hear how this is able to help others take that next step by getting their charting done for what matters most to them. So I hope you come back next week, and I'm so thankful that you've been here with me today. So thankful for you, and thanks for all that you do. Have a great day.